Hello, everyone, and thank you for joining me once again on Phoenix Rising, A Way Towards Health. I'm Krista Townsend, and I'm your host. Today, let me tell you first, it's my mission to bring you information on natural and holistic healing methods, products, and services. And today I have Nikki Imes. And Nikki is a certified professional midwife and craniosacral therapist. It's her philosophy that pregnancy and birth are powerful times in a woman's life, and the role of a midwife is to support a woman in finding her own inner strength as she creates and brings forth her child. Welcome, Nikki, and thank you for being here today.
Thanks for having me, Krista.
Yeah, this is great. And I want to say your philosophy is really beautiful, by the way.
Thank you.
I love that.
Yeah.
I love that. All right. And I just also want to mention that I have known you since you were a little girl,
Yes.
about 4 or 5, and we talked about briefly. So I've watched you grow up into an amazing woman and kind of seen your journey here. And also going to mention that I almost married your uncle.
Yes, almost. But hey,
Yeah, that's really the closest I've ever been to getting married, actually. But that was a few years ago. Okay, so you've been doing this for quite a while, and I guess you've birthed a lot of babies. So how many births have you attended?
Combining my experience as a birth doula, which I started off as a birth doula, labor support, and a midwife's assistant, I've been to over 400 births.
Okay.
And not all of those have been, midwifery births. Some of them have been, supporting a mom in a C-section as a birth doula. And so I've been to pretty much every birth experience you can imagine at this point. So
Yeah. That's a lot of babies. That's quite a few.
Yeah.
That's quite a few. So tell me, what is a midwife, and what led you to become a midwife?
So a midwife is a trained professional who is, our job is to provide prenatal care. So providing education and health support and monitoring of mom and baby's health and well-being during the pregnancy. We're also trained in delivering babies, even though we like to say that pieces are delivered, babies are born. But the idea being the trained person in the room that helps a mom as she's giving birth to her baby. And we also provide postpartum support, so taking care of mom and baby anywhere from 2 to 12 weeks after the baby has been born.
Which is also called the fourth trimester.
The fourth trimester, yes.
Heard of that before.
Yeah, which we know it's a misnomer. But the interesting thing about human babies is that actually compared to other primates, human babies are actually born when they're what we consider full term. They're actually born immature compared to other primates. So that first 12 weeks, those 3 months after a baby is born, they need a lot of time skin to skin with their mom. Moms and parents are learning how to take care of those babies. They're wholly dependent on their parents and helping to protect that time to, hopefully facilitate the best start in life for moms and babies together.
Right. And they're still forming a little bit in like their skull and
there's a lot of development that's going on externally. They're newborns can't really regulate their own body temperature. That's why you hear a lot about skin to skin. Is temperature. It helps to regulate their digestive system, their nervous system, all kinds of things. So keeping your babies close is a really important part of that. And so being able to help facilitate that for moms and babies by providing that supportive care so that they can just focus on taking care of themselves and their babies.
Right.
Too.
Okay.
So,
very good.
And what got me into midwifery, honestly, I have been interested in birth and being there for birth experiences since I was about 8 years old. My mom had midwifery supported births with some of my siblings. I was able to look through some of the natural childbirth books that she brought from her Bradley Method childbirth classes. I found the pictures and the stories fascinating. And so as I had more and more siblings, I was introduced to the pregnancy process, the birth process more and more so that I could be present for a couple of my siblings' births that were supported by midwives. And so So actually, the midwife that delivered my two youngest siblings is one of my colleagues. She was one of my preceptors, and I actually am in practice with her today.
Oh,
so it's a
wow.
pretty amazing, amazing extension of our experience.
Well, I think it's just a
too.
natural thing that you went into that. I mean,
Yeah.
and I can certainly see how that would have a big influence on you and your choice of career.
Yeah.
To be there, and I think it's wonderful that your mom let you be a part of that and participate in that. So.
And it was great that, she felt supported in her decision to have me present, too, as well. When my youngest sibling was born, I was actually already a trained birth doula. I'd already gone to trainings to learn how to be helpful and supportive in the birth process. So I not only was there for the experience as a family member and a sibling, but I had already had some tools and skills in my belt to be able to provide support
Right.
at that time.
Okay.
So.
And so what are some of the reasons an expecting mother might choose to have a midwife?
Well, so, first of all, an important thing to always to be aware of is that midwives, whether certified nurse midwives or myself, certified professional midwives, we take care of low-risk women. Right. So women who are otherwise generally healthy, because we're there to provide that time frame that moms might need a little more time in her appointment to ask questions, to help with education. And also we tend to be able to provide a little bit more personalized care for families and the pregnant person. Sometimes, particularly if you're planning a hospital birth, you can kind of get swept up in the protocols and things like that. Whereas an
Of the hospital?
Of the hospital,
Right,
yeah. Whereas an
right.
out-of-hospital experience, whether a birthing center or a home birth, we're on your turf, and we're being welcomed into your experience as a guest, and so we're going to be able to adapt more to what you need, whether it's having your birth doula and your birth photographer and your husband and your teenage daughter all there to be part of your support, or just going like, oh yeah, of course, delayed cord clamping, that's like we all do that. That's not something that's a new radical concept to a midwife, and if you want to spend a complete hour, completely uninterrupted, and nobody messing with your baby, that's what we work for. So a lot of times women find that the things that they're leaning towards in their birth experience, they don't have to convince us to be on board, because either it's something we're used to doing, or it's not something that is unusual for us to have as a request.
Right. So they get to be a lot more involved in the decision-making process.
Exactly.
Basically.
We talk about, informed decision-making, not just informed consent. Informed consent kind of, that's important, but it kind of lends towards the thought of that you're having to concede to a process,
Right.
whereas informed decision-making is where we both come to the table as your care provider and you as the pregnant person and say, okay, here's things we need to consider. What have you learned about it? What educational information do you need? And what seems to resonate with you? But it also allows us to come to the process and say, hey, we don't feel comfortable maybe with this particular scenario. Here's some way that we can, get you in contact with a provider that might be able to provide everything that you're going to need too. It's decision-making processes where we both are participating.
As a team.
As a
right,
team. Yeah,
right,
exactly.
Right. And what exactly is delayed cord clamping?
So delayed cord clamping is basically waiting until the umbilical cord stops pulsing and allowing baby to regain their full volume of blood supply from the placenta before we clamp
Cut
and
it
cut the
off?
cord. So there's more and more studies that are showing the benefits, looking at the numbers, looking at babies later on when they're 6 months old, a year old, and the benefits of delayed cord clamping. But because studies are very much about numbers and things like that, first they were like, okay, 30 seconds. And then they're like, okay, 60 seconds. And then it's like, well, maybe if we wait 5 minutes. Whereas most midwives will just wait till it stops pulsing. And that can be as little as 60 seconds. That can be as long as 15 minutes. A third of the baby's blood supply is in the placenta at any given time. Going to the placenta, receiving nutrients, oxygenation, dropping off waste, dropping off, anything else that the placenta needs to filter out, and then coming back to the baby. So once the baby is born, there's a third of that blood supply that's still in the placenta. If we
That's quite a bit too. I didn't realize. Wow.
That is a large. Honestly,
Yeah.
if an adult was deprived of a third of their blood supply, we would consider them having a huge hemorrhage, and we would possibly provide them a blood transfusion because that's a large volume of blood to lose.
Wow. So not a good way to start off. right
Well,
off the
and
bat.
it also provides like
Because don't they usually cut the cord pretty immediately in a traditional birth?
in the traditional setting in the last 100 years, that has been, what has happened. Immediately clamp the cord, immediately cut it. And because I've heard everything from, well, if the baby gets too much blood, they'll have really bad jaundice, to if you don't cut the cord, the baby will never try to breathe. There's a lot of different thoughts processes about that that haven't really been proven with even scientific studies and scientific research. So,
Wow. Okay. That's interesting. And so the baby, I guess if you're not clamping the cord right away, then the mother and baby can just bond and then just let it naturally. And then is there a point where you can tell when it's ready? You can Can you actually see the blood flow?
You can feel it.
Oh, okay.
So think about the fact that you can feel your own pulse. Whenever you're gently touching a umbilical cord after a baby is freshly born, you can actually feel the pulse because it's actually generated by the baby's heartbeat.
Oh, okay. Well, that sounds normal.
And
then.
you'll see the cord go from kind of a purplish, fat, engorged,
like a
vessel,
vein.
like a vein, yes,
Right.
and then
'Cause
gradually.
really, that's what it is.
It actually, the umbilical cord actually wraps around and protects three vessels, actually. It's actually 2 arteries and 1 vein. So you've got the system going to the baby and the system coming away from the baby. And then eventually it becomes less and less strong. Eventually it starts to get flat and white in color. And usually, if the placenta itself isn't already ready to be delivered by that time, it shortly will come out spontaneously at that point anyway, too.
Okay.
So, yeah.
All right, very good. And I did want to mention, I maybe should have mentioned this in the beginning, but so midwifery is, it's really an ancient practice.
Yes.
I mean, that's typically how women had babies a long time ago.
Yeah.
And so, having hospital births is more of a modern occurrence, whereas that's how women used to have a midwife, and
whether
so it goes way back.
Whether you were
it's not
called
really
a
new.
midwife or not, there was usually at least 1 or 2 women that were part of the community that were trained in childbirth and being supportive in childbirth and that immediate time afterwards too. Sometimes they, were interested in it and learned it. Sometimes their grandma did it and they got drug along as part of the process as a helper and learned it, whether they wanted to or not. So, midwives have been around since, a lot of people will remember reading about it in the Old Testament, in the book of Exodus.
Right,
about
that's
midwives.
what I thought. Well, and it just makes sense for a woman giving birth to be surrounded by a supportive system of other women.
Yep.
Because who would know a woman's body better than another woman?
Exactly.
Especially the birthing process, so... okay, well, so what are there some other benefits for a woman using a midwife that we haven't covered yet?
Well, a lot of it is
For both mother and baby.
For mother and baby is, being able to we typically have more time to spend with our clients in their regular, appointments. We have, a lot of midwives have been even extending the time that they spend with a mom postpartum. Usually we would, visit them at least once at home after their baby is born in that first week, see them again around 2 weeks and again around 6 weeks postpartum. Many of us have extended that care all the way to 12 weeks, seeing our moms a couple more times in that time frame. That means we're seeing, better success rates at breastfeeding long term. We're seeing babies with better weight gain. I work a lot as a midwife and a craniosacral therapist with infants that are experiencing tongue tie and experiencing difficulties with breastfeeding and that. And sometimes those hurdles take a while to overcome. And so, 6 weeks is usually about the time most women are just getting their feet back on the ground and figuring out, okay, what is life going to be like with this new family member? And so being able to help them integrate, that new family member and once they've recovered physically is really helpful.
And then you are there to assist with breastfeeding and if there's any issues there or just giving them some guidance and advice. So
exactly.
I think that's really helpful as well.
Yeah. We see mom and baby as 2 parts of a relationship, a mom-baby dyad. So in the traditional model, you would typically see your OBGYN for your postpartum care, and your baby goes to your pediatrician. But sometimes the pieces don't get put together with, Oh, okay. So maybe that, thrush that you have on your breast that your OBGYN is treating is giving your baby a problem, and that may be why your baby's having difficulty nursing. Your pediatrician isn't aware of that because you may have not thought to mention it.
Right.
And so when we see them together, oftentimes we can clue into those kinds of things too.
Back to the holistic version
Exactly.
of
Yeah,
healthcare.
exactly, yes.
Which, as everyone should know, I'm a big proponent of. So I like to throw that in there because that's why it's so important to look at everybody and health from a holistic perspective, because you're more likely to catch the issues, that might be occurring if you're looking at the person as a whole, or the mother and the baby as a whole unit. So, so do most people that choose to have a midwife choose home birthing? Or do they like to go to the birth center? And I know you can accompany them to a hospital birth.
So for our practice, we are seeing probably about a 50-50 split these days. Our birthing center has two rooms dedicated. It's a lot of people feel very comfortable there.
And they're like a home-like environment.
It's a home-like environment, yeah, exactly. Other midwives who may not have a birthing center, their practice is exclusively, home birth based. Midwives, certified nurse midwives, practice in the hospitals or at home or birthing centers. So if someone is choosing a CNM, they've got those options available to them as well. If I had a client that for some reason, perhaps late in her pregnancy, became high risk, like perhaps she developed late onset, high blood pressure or something like that, prior to COVID, we've had some really friendly relationships with hospitals around here that they welcome us to be there as a support person if the mom does end up having a hospital birth too. But right now with reduced amount of people attending the births, it's usually just the partner, husband, or something like that accompanies a mom to a hospital birth these days, which is why a lot of people are looking into home birth and birthing center birth, because in your own home, it's a lot easier to be able to have a few more people at your birth than having to deal with hospital restrictions right now.
Right, absolutely. So in the event there are complications, how do you handle that?
So that is a big part of our training. A big part of our training is to, first of all, recognize signs that may be leading us to the thoughts of like, oh, this might become complicated. So oftentimes we will, we like to say our guidelines of safety are a lot stricter and a lot more narrow than what might be in the hospital, because they have all those resources immediately at their disposal. So we're more likely to have a mom and baby or baby go in prior to it becoming critical. But if something happens quickly, that we're trained in neonatal resuscitation. We have, things at our disposal, our hands, herbs, things like that to help stabilize a mom or baby if we need to, until they need to, if we need to transport, we can get everybody stabilized until they go in.
Okay, great. Now, and what is water birthing an option?
Of course.
Okay.
We love it. Love water birth. A lot of moms love the option of having water in labor, whether it's the shower or being submerged in their own bathtub, a birthing pool. That hydrotherapy provides such great relief, particularly if you're in a pool or something where you can be buoyant. Most women report that it diminishes the intensity of the contractions and gives them more freedom of movement during their labor. Some of our moms do have water births. We love doing water births. It's great. It's very safe. There's lots of studies actually now that it's safe for babies as well as moms. But some people just enjoy, just being in the water for their labor, and then decide for them it works better to get out to actually push.
Oh, okay.
So, yeah.
Okay. But I can see how it could be very relaxing to be in some nice warm water. And, of course, the baby is already in fluid.
Yep.
So coming into fluid, there's no
a lot
harm
of
or
water
risk.
birth babies are born very calm. They tend to breathe quietly. They often don't cry for several minutes, even though they're breathing just fine. We're listening to their heart and lungs with our stethoscopes and everything like that, because it's almost like they don't realize they've been born. They're kind of like, whoa.
So it's not such a drastic change.
Yeah.
I love that.
Yeah.
That's beautiful. Well, we're so much of our body is made up of water, so it's just so natural for all of us to be in the water from the start.
Yeah.
So, well, just tell me briefly what craniosacral therapy is.
So craniosacral therapy is a gentle, manual, hands-on therapy. It was actually developed by a DO, an osteopathic physician, I believe in the 1970s, Dr. Upledger. He's actually his institute is actually based in Florida here in the United States. It is something that is very complementary to things like chiropractic care, acupuncture. The idea being that less is more. So we're gently working with the bones in the head, the bones in the sacrum, the soft tissue, fascia muscles to balance the central nervous system, release restrictions in the body, and particularly for infants and pregnant women, it's a really great place to gently help balance the body to provide better breastfeeding experience, postpartum recovery, but it's appropriate for almost anyone. There's actually full practices dedicated to geriatrics or to PTSD survivors, veterans, things
So
like that.
this is for the mother
Or the baby.
or the baby. Okay,
Yeah,
okay.
exactly.
I'm not that
Yeah.
familiar with it, so
Yeah.
I need to do a little more research.
Yeah, you may
on
even
it.
need a whole show on craniosacral. It's its own, very wide modality. It's an international modality, and there's some really amazing things being done around the world with craniosacral.
Okay, great. Well, I'll look into that. And then maybe
Shameless
I'll
plug
have
there.
I'll either have you back or maybe you can recommend someone else. So, so you are with midwifery or community midwifery services. Is that the name of?
Yes.
Okay. And if someone would like to know more information or get a hold of you if they're interested in having a midwife,
Check out our website,
Okay.
cmsmidwife.com.
Okay.
We're also on Facebook, Community Midwifery Service, or you can give us a call. We're a little fashioned. We do a lot better via phone calls, 405-447-9433. Our birth center is in Norman. We're based in Norman, but we serve the greater Oklahoma, central Oklahoma, southern Oklahoma. We have a satellite location in North Oklahoma City. So we try to cover basically about half the state for home birth and birthing center services.
Wide area.
Yeah.
Well, I will put a link and your phone number, link to your website and the phone number and everything below this video.
Okay.
So that people will have that information.
Great.
And is there anything else you'd like to add that we haven't covered?
I don't think so. I mean, I could talk about birth and body work for hours and hours, but I'm excited to get this information out to people and provide that holistic care.
Yeah, I agree. I've been a proponent of it, even though I've never had any children. But I think if you can, that's the way to go.
Yeah,
natural birth all the way.
Yeah.
So, well, thank you so much for
you're
being
welcome.
here.
Thanks for having me.
It's been fun. Yeah. So, well, again, thank you everyone for joining me today. I do appreciate you tuning in. Remember that health is wealth and nature is the best medicine. I'm Krista Townsend with Phoenix Rising, wishing you the best of health. Take care, my friends.